Hello, my name is Dr. Augustine. Today we're going to be introducing to you Myra Lynn. She came in 2017 for some healthcare, and we're going to chat back and forth to see how her experience was here in our office. So this is Myra Lynn.
Good morning. Happy blessed Monday today.
Yes, it is. Yeah. So I met you in 2017. You had some problems back then.
Yes.
But we wanted to talk more about current stuff that's been going on.
Yes.
How many years passed? 3 or 4 years?
Close to 3 years.
Okay. Then you came in because of what?
I've been experiencing lots of left-sided pain on my left side, and I wasn't able to see my doctor due to COVID happening last January. It was last January. Yeah. And because of that, I wasn't able to go see my OB, to get checked out until about June. And so in June, my doctor prescribed a ultrasound. So we got that done ASAP, and they find out that I have a cyst growing on my left ovary, and I'm having fibroids growing throughout my uterus cervical area. And the option they had told me they diagnosed me with endometriosis and recommended that I have a hysterectomy.
A complete hysterectomy, everything?
Yes.
Okay.
Yes.
Not fun.
And I was really, really not for it. First, they actually prescribed me Orlissa to help with the pain. It didn't even help, unfortunately, and it was only like a two-year term limit of using that medication. And I was like, I took it and it didn't work, so I just stopped it. I was like, I'm not gonna use this. What's the point? It's just like my other experiences with pain medicines, right. They didn't really help.
So we did testing, we did scans on you.
Mm-hmm. Many scans and testings with you. Then I decided to come back and start the program with the biocranial and the cell therapy, and which was an answer prayed for me back in 2017 after my first health call with a fall after I delivered my first daughter. Mm-hmm. So that was the start of a lot of autoimmune disorders that you found out with RA, being diagnosed with RA, fibroneuropathy, lots of inflammation in my body. I remember that when I first started. And starting those programs here with the biocranial and cell therapy, I was like, here, maybe how many times I was on that for quite a while. Yeah. Maybe like a good 4 or 5 12-week sessions. It was a quite long journey with the healing process here.
But the most recent thing was, I think you were maybe 24 or 36 visits into doing cell exercise, you did nutrition, you changed your diet, you were taking
Yes, that's right. How did I forget that? So my husband and I finally worked together and started keto together. And because prior it wouldn't work out, right? So then I actually lost like 30 pounds before I found out I was pregnant in March, because they scheduled me as a hysterectomy for October 7 of 2020. Mm-hmm. I find out a week before that I'm actually pregnant.
So that was only maybe
not even that long from when I started the
6-8 weeks into our
after
care.
being diagnosed with endometriosis and all those.
Yeah.
Mm-hmm.
So you're scheduled for a hysterectomy. Mm-hmm. You get pregnant.
I find out a week before that I'm expecting. Yeah. And so thank God that hysterectomy didn't happen.
Yeah, exactly.
Which I didn't want.
So all those parts still worked.
Yes.
That's great. Excellent. But I think your health wasn't quite there.
No, we were still on the journey of healing what was happening in my reproductive area, which was what we were doing. I was taking the, like I said, the cell therapy, the biocranial, the chlorophyll complex vitamins, and all the different, all the women reproductive vitamins that have that work. Everything that you've given me works.
Well, we can tell it worked, right?
Well, hello, here we go at 30 weeks today.
Yes. And so you're still coming in since being pregnant, we're adjusting the baby's home to make sure your pelvis is perfectly balanced so that you have a great delivery.
Please, because I don't want another 29-hour or a 3-day one. Yeah. I got 2 girls at home, and those were long labors, and I'm just hoping and praying this baby boy comes on is nice to mommy.
And you're getting your boy this time.
Oh gosh, yes, finally got the boy. So unfortunately, I lost the baby that I was pregnant with last year, right when we found out a week before my hysterectomy was supposed to happen. I lost him November 13th, which is actually the best friend of my best friend's birthday, who I lost 3 years ago. So I knew he would be okay, and she's with him. So it was a tough night. That was during COVID time. My husband couldn't be there. It was just me and God, just carried me through that night. And And then so then in March, I find out I'm pregnant again. And we find out in June that it's a boy.
Currently, what we're doing
Yes.
is you're coming in weekly.
Yes. For
Getting
my
adjusted.
adjustments, my biocranials and my adjustments. And I'm still on the vitamins regimen, the diet. Not as good as it used to be because I am having a little bit of carbs because, it's kind of hard when the baby wants carbs. And Dr. A knows, I tell him. But, but definitely once baby's out, I'm going to get back onto that keto and stay away from the carbs. And another good thing is I passed my glucose test.
Nice.
And that's a good thing. So no gestational diabetes over here, thank God. Yeah, so everything's good. And I was like so happy too because you know how it is. They, once you're over 35, they tell me I'm like a high risk pregnancy.
Right. Well, the plan is we always talk about, she's making a baby.
Right, I think
and
remembering.
so the best, when my wife was pregnant, she was taking tons of nutrients. We were adjusting her, and because the better that health you could be into,
right,
then the better the baby is going to be. Yeah, so it'll work that way nicely.
I agree.
And you've been great, right? We've been adjusting you, keeping that pelvis balanced, and baby's happy, and you're happy, and
yes, he is like a.
we just need to keep you to avoid stress.
Yes, I know. I've learned. I had to learn the hard way, but I've definitely learned how to let go and go with the flow now.
Awesome.
Just took me 40 years.
That's okay. Stress is bad for everybody.
I know. It's a silent one. I hate to say it, silent killer, but.
So our plan originally when Myra Lynn came back was to deal with getting her tissues to heal. And so how do we do that? We typically would do biocranial because the real doctor healer for Myra Lynn is really her brain, so we would jumpstart her brain with biocranial. We also structurally adjust it to keep her nervous system, her spine balanced, which frees up her nervous system to heal the body. We also use nutrients, specific nutrients, especially to maximize her reproductive organ systems. But then, potentially she could get pregnant, and that's exactly what she did. Plus, this time also nutrients to maintain that pregnancy, like chlorophyll pearls.
The chlorophyll complex.
Awesome. All the precursors to make the best reproductive hormones that she needed. And it worked out super well. We also charged her up with cell exercise. Cell exercise puts energy back into those tissues and cells and normalizes the function of tissue so that it could take in all those nutrients from her food. We changed her diet as well. So her tissues and cells could take in the nutrients and do what they needed to do, which is heal and be happy and function well. And she did awesome. So Myra Lynn, you were on chlorophyll pearl complex, which is amazing. So it's the fat-soluble side of chlorophyll that has all the precursors to make those great hormones that she needs to have this pregnancy and maintain this pregnancy, which is awesome. And what else were you on?
The adrenal desiccated.
Adrenal desiccated because she had lots of stress. And we needed to continue to support her adrenals, which will help the baby also and the baby's adrenals too.
And I noticed when he first gave me that vitamin, it was like an instant fix. I remember you were like, just take 3 in the morning and 3 at night, and my energy levels I was getting really, really fatigued and tired, remember? And I was like, I just don't feel good, especially with growing a baby, of course. But that helped instantly. That same day you gave it to me, and I took it when I got home, and I was like, I was actually okay. I didn't take a nap. Like, I didn't fall asleep around like 5 and be done for the day. My husband was like, there's no more mommy at 5 o'clock because I'd be knocked out. Right. Yeah, that helped. That worked instantly.
And Liviplex,
the Liviplex for the liver, yeah.
For her liver, helps her liver. It's whole food nutrition for just her liver. Her liver is super busy working for 2, herself and the baby, and processing hormones and metabolism and so much. Liviplex was awesome. You did DIAPLEX. Because she was skirting blood sugar issues at the time, and so that she would go into this pregnancy and not have it develop gestational diabetes, it really supports her pancreas function and keeps her blood sugar nice and stable and normal. So
yes, and then the prenatals, of course.
Yeah, prenatals, which had a ton of other things in it. It's just all those other fill in your nutrients kind of thing to make sure her body's in great shape and the baby's in great shape.
And then the vitamin D drops.
Yeah, vitamin D drops, Liquid D was wonderful stuff because it's so simple to take 10 or 20 drops at one point.
Yeah. I just feel maybe like close to a fourth of the vial, like maybe like less than half of the vial that it comes in.
So this is Myra Lynn's testimonial story about her experience here in my office. She's been awesome, and she's of course gets a present at the end, which is great.
Right. In time for Christmas.
Yeah, exactly. Christmas present. Right. Perfect. So I'm on lots of social media. I'm actually on TikTok. I'm on Facebook. I'm on Instagram as well as YouTube. So I have a YouTube channel as well. So my name is Dr. Augustine. Have a great day.